The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm Dr. Joe Gambardella with Advanced Physical Medicine and Rehab. You can check us out and follow us on Instagram at APMR Miami, and also find us at our website, apmrmiami.com. I'm here today with Rob Sapero, our office manager, and we have our special guest, Mark Brodsky. He is our physical therapy assistant, nutritional expert, and overall fantastic person. What's going on, Mark?
Hey, how you doing, Dr. Joe?
Fantastic. Today we have a great topic. It's something that can benefit everyone listening, and it's secrets to weight loss. But before we get into the secrets, I want to bring it around to how weight loss has become so prominent in our office. We have a physical medicine center located here in Miami, 7170 Southwest 117th Avenue, on the corner of Sunset and 117th Ave. We see athletes, we see weekend warriors, pediatrics, geriatrics. One thing they have in common is that they all suffer from injuries that they're not able to recover from by themselves. So they make their way into the office. Oftentimes they find out about us on the radio show, through social media. 90% of the time it's from a referral from one of our patients or other doctors. When you work with some of these patients, Mark, whether they're knees, lower backs, I know one of your bugs has always been, well, what about the excess weight? We're really managing and helping these patients recover, getting healthier knees, getting healthier shoulders. But an underlying problem that has always persisted and seems to be getting worse is excess weight.
Yeah, we see that a lot, and it's a tough one to challenge. It's a tough challenge because people have habits. They come in and they're hard to break. You don't want to always. It's hard to address that right out of the gate with them, but it is something that needs to be brought up, and we do our best to, educate the patients on the importance of maintaining a healthier weight and how that affects their overall health in general. So we end up opening up a can of worms, so to speak, but then we do our best to, keep the patients motivated and help them along in their process as they are, recovering from what they're going through. Yeah.
Interestingly enough, you would think the hardest thing to help a patient who has a degenerative condition, a bad knee, a bad shoulder, a bad lower back or neck, would be to recover from those injuries. And interestingly enough, with all of our new technology, whether it be non-surgical, spinal decompression, prolozone, allografts containing stem cells, shockwave, laser, all those things you can hear and catch us on our previous episodes by visiting our website, apmrmiami.com, and going to the radio section. The most challenging has been to really make people aware that weight is a complicating factor. We oftentimes now see the objective findings change. X-rays are getting better. Ranges of motion are getting better. Pain is decreasing, but patients still say, it's the weight that's the problem. And they often have a tougher time tackling the weight than actually the rehab.
Yeah, it's sad. It's true, though. You see it a lot. And when you ask them about their daily, habits and things that they do, and you can usually tell, obviously, but yeah, and it's hard. But when somebody wants to do something, they usually will take those steps. And in most cases, you find people are making attempts, but they're challenged. I mean, I have worked with people where they were on a journey themselves trying to lose, but their partners weren't very helpful, in that process. And there's so many factors that are involved, but you have to be almost selfish in a way in your approach, because you can't let other people, influence you when you're, trying to make a change. It's really difficult.
Yeah. Do you mind, Mark, if I tell the audience your age?
No, not at all.
Mark is 50-ish, right? How old are you?
I'm 56.
56, but Wanda, I know when you saw him today, you said, "Hey, Mr. Fit is here." He looks better now, and as I understand, better than you ever had before. Mark, when people come into the office, they're drawn to him because he's in great shape. He looks like he should be doing infomercials on TV on weight loss and exercise, but he's in our office. So people are drawn to him. And if you take people through your routine, Mark, about how you find the time to eat right and exercise, it's not easy, but you get it done. Like, for example, our office is open pretty much from 9 to 7 p.m. It doesn't mean we start at 9. What time everybody gets into the office? Around 8:15, 8:30?
Yeah.
We say we close at 7. What time does everyone usually leave the office?
Well, 7:30, 8 o'clock. Yeah.
7:30, 8 o'clock. So when does that leave time to eat right or exercise? How do you get it done?
Yeah. Well, I've been recently, for the past year and a half now, I've been following the intermittent fasting protocol, which works really well for me. And that basically, it sounds pretty complicated, but it's really not. It's just a time frame in where you take in your macros, that which you want to eat. And my window, the studies have shown that if you're, giving yourself about 16 hours, you're actually benefiting. The health benefits are tremendous in what you get out of just not putting food into your digestive system. Yeah. And so I eat between the hours of 1 and 9 o'clock and p.m. Yeah, that's it. Yeah, well, and then I sleep. So it's not hard for me. For me, I've really responded well to it. I feel good, and we're fortunate in our job. We can nibble if we want to, but it hasn't been that difficult. I know that people have a relationship to their foods and the times that they have to eat, and I talk to friends and family members and.
What are some of the biggest changes that you've seen since starting intermittent fasting?
For myself?
Yeah.
Well, my body fat percentage dropped considerably. I also noticed a clarity in just my thoughts. Yeah. Which is pretty interesting. That would be probably the most significant thing that I really feel. It feels good to just not have to be consuming all the time, and you do feel like a cleanse, so to speak. You get your focus is a little different.
I would say that the three biggest things that we see, and why we put almost all of our patients who are working on weight loss programs and balancing hormones on this intermittent fasting, is you're going to see rapid weight loss.
Yeah.
Very, very quickly. Within the first couple of weeks, you're going to lose anywhere from 5 to 15 pounds if you have excess weight that you're carrying. The second thing is huge increases in energy. So you have an increase in metabolism, an increase in focus. So you're able to get through the day, get more things done because you're focused, determined, and that's without any type of medication. And the biggest thing that really has helped us in our practice is significant reduction in inflammation.
Yeah.
So it just goes hand in hand with the recovery of treating shoulders, knees, hips, that, if you can combat inflammation through foods that you're eating and eliminate foods that cause the inflammation, and also get it down into that window where your body is burning fat 90% of the time and then processing energy the other 10% of the time. I mean, that's pretty much the secret to healthy joints. Yeah. We preach to our patients that we want to give them two things. The reason we like to work with all of our patients, number one, we want to make them have less pain, right? We want everyone to live to be over 100, but we have to do it with less pain, and we have to be able to perform. So performance on every level, whether it's at work, whether it's home, whether it's socially, you have to be able to perform. There's no point in, being able to have a nice, healthy quality of life, but you can't do the things that you love to do.
Yeah. Well, that's what you see a lot as well. It's sad because people, they come in and they're having a difficulty walking. They're using, canes, and, they don't look happy. They are suffering, and it's, we do our best to help them get to where they need to be with that. it's a challenge. It's a cultural challenge. We see it. I notice it a lot. But I was just at a dinner and I was talking about it, and they were all concerned about the idea that your program that you have to eat. You don't really have to eat that much, and that's as easy as it sounds. It's a little bit of a challenge.
Let's talk about some more benefits and actually get into some of the specifics of our weight loss program. Number one, the reason why weight loss is so important to control inflammation is because every pound of excess weight that you carry is equivalent to 4 extra pounds on a damaged joint.
Yeah.
So I don't know anybody who's only a pound overweight. Most people are 5 pounds or 10 pounds, but let's just say that you are 15 pounds overweight. That's 60 extra pounds crushing your damaged knee, crushing your lower back.
Yeah.
So a third of the solution is getting that weight off. Now, how do you do it safely? How do you do it effectively? And that's what we're really going to get into today, which is our medical weight loss program. And our medical weight loss program has essentially 5 components. The first one is, how do you safely and effectively suppress or reduce the appetite so you're not eating yourself out of house and home? Number 1, we'll talk about that. Number 2, what's the best weight loss program for you? Is it something that focuses on intermittent fasting with some light ketosis? Is it a paleo diet? Is it a Mediterranean diet? You know what? You know how you know? Without guessing, blood work. So complete blood work. We have to know what your blood type is. We have to know what your inflammatory markers are, because there's no specific diet that works for everyone, but there is a diet that works for everyone. Okay? So in other words, paleo doesn't work for everybody. Paleo may work for one person, keto may work for another, but when you do a complete blood work, you're going to know what diet works for you. So it takes the guesswork out. The second thing is diet modification, learning how to eat. You mentioned something earlier, Mark, macros. There's probably people out there that don't know what macros are. Macros are macronutrients. They're the 3 basic food blocks that compose our diet, which are carbohydrates, fats, and proteins. Each one has a different caloric equivalent. And then we have things to decrease insulin resistance. So number 4 is, how do you decrease insulin resistance? How do you actually shed body fat so that your body could reduce inflammation and you could take pressure off the joints? And then the 5th thing, and maybe the most important thing, which is what you do, Mark, every single day, is personalized coaching and support. You know, whether you're rehabbing the patient or whether you're talking them through this weight loss program, I think generally speaking, when people start this program, Rob, what would you say? Within the first month, what's the average weight loss? Just being very conservative.
Anywhere between 20, 25 pounds, and that's speaking conservative. It might not sound like it, but with this rapid weight loss program, you're losing anywhere between 1 pound to 2 pounds a day. Yeah.
And why is this so important? Number 1, after 50, there's certain parts of the body that never have the ability to heal by themselves. 98% of your body will always heal and repair itself. 2% doesn't. We mentioned that in earlier shows. The 2% that don't repair themselves, discs in the neck, cushions in the knees, connective tissue in the shoulder and the hips, and that's why people come to see us. So there's solutions for that. Check us out, apmrmiami.com. Look at our website, look about Prolozone, regenerative medicine, and find out if you're a candidate and how these things can help you. But some stats are that more than 1/3 of the people in the U.S. are obese. In Miami, it's even higher. Wow. 83% of people that lose weight gain it back within 2 years. And not only do they gain it back, they gain more. So you've heard the old adage that the first 3 letters in diet is die, right? It's a slow death by becoming insulin resistant, sugar creeping up, blood vessels becoming damaged. It affects the brain. Blood gets thicker. It puts stress on the kidneys. The ability to detox the body drastically decreases. So these are just some of the reasons why weight loss becomes so important. And 50% of those people that were on a diet now weigh more than 10 pounds heavier than when they started the diet. So not only do they gain it back, but they gain back a significant amount of weight above where they started before. Right. So we're not about the yo-yo diets. We're talking about permanent weight loss to eliminate cravings, to save your joints, to feel better, and to look better. So there's 3 secrets to this permanent weight loss program that you have to know about. We're going to talk about those right after the break.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
And we're back. Our topic today is medical weight loss. How do you do it safely, effectively, and permanently? First secret, reduce insulin resistance. How do you do that? You got to get rid of belly fat. One of the things that we use to reduce insulin resistance is simply an exercise. They're called 10-10s. If you could do 10 10-minute walks a week, that has been shown to be even more effective at controlling insulin resistance than using substances like metformin, glucophage, which are first-line medical prescription medications that are used to make the body more insulin sensitive. So if you walk 10 minutes a day, 10 different times during the week, you could easily do it 10 minutes on Saturday and Sunday twice a day, and just a 10-minute walk Monday through Friday, you got it made. Okay? So that'll help you reduce insulin resistance. There is also compounds that we use in the office.
Diaxanol is a good one.
Yep. There's another substance that we use called naltrexone. Right? Naltrexone is a medication that's used for opioid overdoses, but it's used also for weight loss because it significantly reduces insulin resistance. When you are insulin resistant, here's what happens in your body. You take in sugar, you take in carbs. Your body doesn't release enough insulin, or it releases it all at one time. Insulin's job is to grab carbohydrates and sugar, take them out of the blood and store them in the liver for energy. So the more sugar that's taken out of the blood, the more energy that you have. If you don't release insulin, you're left with sludge in your system. And instead of being stored for energy, it destroys your blood vessels and slowly but surely destroys your kidneys. And that's why so many people who become diabetic wind up on dialysis. So you have to reduce the insulin resistance. Number two is we use a compound called HCG, human chorionic gonadotropin. It's a hormone that's produced naturally in the body. It's produced primarily during pregnancy, but it's used in microscopic doses to mobilize body fat for energy. So how great is this? You can reduce your caloric intake, and instead of your body burning muscle, you can burn fat, and not only burn fat, but burn fat in the hard-to-reach parts of the body that you never lose when you diet. When you diet, you always lose fat, and you become something called skinny fat, right? You weigh less, but you look the same. So by using HCG, which is part of our weight loss program, we're able to engineer the body to burn fat for energy and preserve and save the muscle. So you actually tone, tighten skin, increase energy, clear your blood vessels, and become healthier as you're losing weight. So that's the first secret, insulin resistance by controlling appetite. Second thing is, how do we suppress the appetite when we have these enormous cravings? It's hard to do when you first start. So we use something called Adipex, right? Adipex is phentermine for people who are qualified. That's why the purpose of doing complete blood work. And it's a weight loss medication that helps adults control their appetite. If you have a basal metabolic rate over 30, for those of you who want to know what that is, come to the office. We'll screen your BMI and tell you if you're a candidate for this specific type of appetite suppressant. Another one is called Garcinia cambogia. So I know everyone wants to try to lose weight, but they can't even make it past a day or two because they have these cravings. These two compounds completely eliminate the cravings. So you can focus on recovery, repair, doing the things that you want to do to get more productive at work, but you're not going to have any cravings at all once you start this program. That's the best part. It's easy to follow. So whether your goal is to lose 20 pounds, 30 pounds, 40 pounds, or 50 pounds, let's talk about the takeaways. Number one, we have to control insulin resistance. We do that with 10 10-minute walks a day. Number two is we have to suppress appetite. We're going to use Garcinia, we're going to use Adipex, or a combination of those depending on what your blood work shows. And what are we going to do to make sure that we keep this weight off? You got to weigh in every day, right? And you have to weigh in with us at the office once a week so we can make changes to your program as necessary. You mentioned, Rob, that patients typically lose about 20 to 25 pounds easily within the first month. You manage this very, very closely on the backside with the patients. What are some of the benefits that patients have told you about, or some of the things that they experience with our program that have tried other weight loss programs?
Well, the biggest thing that they like is it's not as hard as they thought it was. You know, when we go through it, there's a lot of instructions. It's very, you got to follow it to the T. This is a very scientific approach to weight loss. It's proven, and if you follow it, it's going to work. Now, you know, they just love how easy it actually is. They love the fact that They can do it anywhere. As far as, it's very simple to make the meals. If you have to eat out, there's alternatives that we give you so you can go ahead and eat out. So just really the ease of it is one of the biggest difference that I've noticed that the patients really enjoy. And then, of course, the results are quick. Everybody loves quick results, especially the way society is these days. They want instant gratification. So when they see a pound, 2 pounds coming off every single day, that's the motivation that keeps them going. It's not something they have to wait a month before they see the results. They see it right away.
It's interesting because when people come in for the different conditions like neck pain, lower pain, or back pain, oftentimes we'll start them with a weight loss program, and they don't even come in for weight loss, but it's such a contributing factor that if we don't get the weight off, there's no point in doing any type of rehab to get any sustained or long-term relief, because it's only going to come back again. So I think one of the many things that our patients really love about us is that we're very upfront and honest with them. We don't sell or deliver false hope. The patient is equally responsible in their recovery as we are. We're mediators, moderators. We give you what you need. We make the body stronger so it could heal by itself, but you have to do your part. Yeah. If I heard Nick Saban yesterday speaking to his team. He said everybody wants to be number one, but not everybody wants to work to be number one.
Yeah.
And you have to take care of your body like it's number one, above and beyond anything else, because that's your vehicle that's going to carry you through life.
Absolutely. Yeah, when the patients come in and they get treated, they need to recognize that's part of like what we do as therapists. We have to find out what their goals are outside of their immediate problem, and in many cases we find out that that's they would like to lose weight, they want to be more active, they want to do things that they used to do, and as part of that is the reduction in their body, the weight that they're carrying. Yeah, and it's always good to see when.
Yeah, and I actually think you do a really good job at that, because like you said, a lot of patients come in for shoulder pain or knee pain, and they don't really realize what's causing the knee pain to begin with. And of course, 9 out of 10 times they're overweight, and that's putting a huge, like you said, pressure, 4 times the amount of their body weight pretty much on one joint. And I think you do a really good job at bringing up that awareness for the patients, that it's like, okay, we're going to do our part, but you got to meet us halfway.
Yeah. And that's a delicate line. You don't want to, put anybody on the defensive, but it is something most people know. They know what they're dealing with, and it's just we do the best, to just bring it out and get them to
finesse it in there.
Yeah,
absolutely.
Yeah.
There's so many fad things out there too that say you take this pill, you lose weight, but you have to change your behaviors. The diet that we prescribe in the office, it's a medical diet. You check in with us once a week, but this is not the way you're going to eat for the rest of your life. We're teaching healthy habits. We're teaching you how to count the macros. How do you know how much protein your body needs to stay healthy, to stay lean? How do you know how much carbohydrates to eat? A lot of people are scared of carbohydrates. We know that they're necessary for so many different things, including the production of healthy hormones. And you have to have fat too. There's people that are all about fat, no carbs, people who are all about protein. Another takeaway from the show is that protein in and of itself isn't the answer to building muscle in and of itself. You can actually take in too much protein and your body turns that into sugar. So we've had some of our bodybuilder patients that have been on a diet like that for many, many, many years, and they're pre-diabetic. So we manage a lot of bodybuilders. We track their blood work, and the 3 most important things that you're going to want to do when you evaluate any type of weight loss program is, number 1, is it effective? Is it safe? Number 2, and number 3, is it going to work for you? The only way you're going to know if it's going to work for you is if you do blood work. And the blood work is easy because we have a lab in our office. People come in, they're fasting in the morning, take the blood work. 1 or 2 days later, we have the results. We know exactly the program that's going to work for them. So it doesn't have to be a scary thing. This is pretty much something that we take you through step by step. And in future episodes, we're going to be having people come on the show that have actually gone through the program and done very, very well with it. I would say with 100% certainty that every single person that's done the weight loss program, Rob, has referred 1 or 2 people into the office.
At least. We don't market for it. This is actually the first time we actually talk about our medical weight loss outside of the office. And it's all based off word of mouth. And I think that's the most natural and organic way to grow any type of service, is the results are there. So they talk to other people about it. They come in and they get the same results. Yep. So it's a great thing.
Our office is on 7170 Southwest 117th Avenue. We're right in front of the Turnpike, easy to get to. Our office number is 305-598-8788. I know lots of you are going to be calling the office with questions. We are having a seminar at the office this Saturday at 11:30 a.m. We're going to be talking about regenerative medicine, weight loss, and successful ways to balance hormones naturally. At that seminar, we're going to be testing testosterone levels. You have to know your number. If you want to lose weight, if you want to recover, you have to know what healthy hormone levels are. We're going to be testing your levels in the office this Saturday at the seminar. Make sure you come and check us out. We're going to be back next time talking about many more great topics, having many more great guests. Mark, thanks for being here. Rob, as always, I'm your healthy host, Dr. Joe Gambardella. Remember, repair, replace, regenerate, and be healthy. We'll see you next time.